So hi guys, I'm Ida Saidi. I'm also a migrant leaders mentee and a medical student. So today I'm going to be talking about applying to medical school, especially from perspective of a year 12 student who's planning to sort of see what they have to do to apply, what's the application process like, and also what is it actually like to be in medical school and beyond. So yeah, just a bit about me before I begin. My family migrated from the Gambia, which is a small place here in West Africa, in the early 2000s. So yeah, we're known as the smiling coast of Africa, which is quite nice. You speak the Olaf language there as well, which I can speak. I'm also a Manchester medical student, so I'm a third year medical student. I'm going into my fourth year in September. Um, I'm originally from London, so moving up north was a bit of a change for me, but I do really, really like it up north. I think I can see myself spending the rest of my life there, which is really nice. So I'm going to be talking mainly about how I'm a medical student. And of course, I'm also a migrant leaders mentee. So just a little bit about why I needed a mentor. So I think it was really important for the guidance for my career. So I need someone who had the gift of retrospect to explain to me sort of what I sort of needed to do and how I could do it. Especially in medicine, it's really easy to sort of see what you need to do and see where you need to be, especially since you're pretty much guaranteed a job after you graduate. But especially as a migrant and someone who's sort of the first person to go to university in my family, I found it really hard to know how to do what I need to do. So I sort of knew, okay, I need sort of research or publications, or this is what I need to do to apply and to do this and that, but how to actually execute it was an issue for me. So I think a mentor was really, really helpful for that. When I was applying to medical school, I had a mentor and I found it really helpful. And also now, as a medical student, I also have a mentor, which is great. Network opportunities. So medicine is such a varied career, and it's also a career where sort of if you meet one healthcare professional, whether that's a nurse or a doctor, that's a relationship or a professional relationship that you can have for life. So being able to network to meet new people in that field and other fields, and also learn how to nurture those, which is sort of jumping ahead a bit, but learning how to form and nurture a professional relationship was so important. You meet a lot of people in medical schools or when you're on placement, especially, and knowing how to keep those sort of relationships for when you graduate is really, really important as well. And also just build my confidence. So it can be really hard, especially when you're a medical student and you're surrounded by these amazing doctors who have done such amazing things, to know how to ask for things and know how to get involved since you're pretty much the bottom of the food chain. So having a mentor helps me build my confidence and sort of learn how to ask, obviously in a professional way, for getting to get involved and what things are going on. So yeah. So this is my student experience with mentorship. So I had exposure or still have exposure to specialties. So especially when I was in year 12, there's so many specialties you hear about and see about, and there's also so many that you know nothing about as well, and you would have never heard about. So having a mentor allows me to sort of be exposed to all these different specialties, shadowing sort of consultants and senior registrars. So I can have an idea of what life is like as a doctor from as a junior doctor, but also as a more senior doctor, which is really nice. Research, so not really relevant, so I won't spend too much time at your stage, but just to be aware of if you can get into research at this sort of level in year 12 or writing blog posts or submitting to essay competitions, definitely do. And a mentor can be a great way to sort of get your hands on that simply because it's so important, but it's also so hard to get into. Well, not really hard, but hard to break into. Once you're in, it's way more, it's way better. But yes, this really helped having a mentor and sort of direct me in the right directions and how to get into research or actually just pull me into any research projects my mentor was getting into. Scrubbing on surgery, so I'm interested in surgery. So yeah, self-explanatory. It's really interesting to see, and especially when you're scrubbing, you can hold instruments, you can sort of hold a suture, so it's always really exciting. Yeah, and also career planning. So again, you have an idea of what you have to do to be a doctor and what that involves, but sort of the nitty gritty of the career is really hard, sometimes hard to understand, you know, where there's so many different sort of pathways, as I'll show you in a different slide. So having a mentor who's been through the pathway and sort of knows how it works and has spent time sort of narrowing down their options and knowing which route to go down is really helpful because now they can sort of look back in retrospect and give me tips on how I should approach that. So yeah, so just some tips. So maintaining the mentee-mentor relationship. So make sure you communicate with your mentor, whether that's just giving them sort of a WhatsApp here and there or an email, however you sort of communicate with them or using the app. Consistency. So just make sure you do it every couple of months just to keep that relationship going. As a mentee, you can be really busy, so can your mentor. So carving out time to make sure you reach out is really great. Being proactive, so don't be scared to reach out to your mentor. You know, they're happy to receive your text or your emails or whatever. And also plan ahead. So it's one thing to reach out and make sure everything's okay, but it's another thing to make sure you have an idea of what you want to get out of the mentee mentor relationship. So it's helpful for you, especially. So, do you want some work experience for your personal statement? Do you sort of want some guidance on writing a personal statement? Do you want some other activities that you can put onto your personal statement or talk about in interviews? So, look at your application as it stands now and see how your mentor can help you enrich and better your application before you have to submit it. So okay, more medicine stuff now. So this is the pathway to becoming a doctor. I feel like it's really important to understand this before you go into applying. And this was something I didn't really look at that much, but I wish I did at your stage. So this can kind of help you plan ahead. Um, I think sometimes people think it's just medicine. If you don't get in the first time, then you can't do it. But don't think that way. So if there's something else you want to do, you can do a degree beforehand. So you can do a graduate degree in whatever you want to do, and then come back and do graduate entry medicine and progress in your career. Similarly, if you're not successful the first time around, because as the years go by, the applications are really difficult. Don't let that deter you from submitting one. Still submit one. There's a chance when you can take a year out, apply again. Applying to medical school is quite difficult. Competition ratios increase every year, but don't let that deter you. I feel like a lot of people say, "Oh, I really wanted to be a doctor and I really want to go to medical school, but it's just so hard." But there's so many different, as you can see here, so many different avenues that you can go to. So yeah, at this stage that you guys are right now, so in year 12, take a look at your application as it stands and see what entry is better for you. So conventional entries where you have a 5 to 6 year medical school degree. So it's pretty much straight from college. That's what I did. Just applied straight from college and went to medical school. If you're interested in sort of a research point of view, if you're at the stage already know what you want to do in your specialty training, feel free to apply for medical school with an integrated degree. So those are mainly London universities. So an integrated degree is basically an extra degree that you do in your 5 years. So you do your 5 years of medical school, you take a year out and you get a whole extra degree that would take 3 years in 1 year. So if you know that you sort of want that time out of medical school, you know that you want to do sort of, I don't know, obstetrics and gynecology, then you can do an integrated degree in that and make sure you go to apply to a medical school that includes that in the training. So foundational access course. So if you're currently sitting here and you're like, oh, I'm not sure if my predicted grades are up to scratch for medical school, or I think I need some more time before I actually get into it, that's completely fine. You can still apply. There are medical schools that have foundational access courses. They take a little bit longer, so it'll take usually about 6 years for you to complete, but it's an additional year before medical school, and it just means that if you don't have the right A levels, or you do have the right A levels, but you don't have the right predicted grades, you can still do medicine with this additional year. So that could be something to think about, and not a lot of people actually consider that as well. It's still the same degree when you graduate. And lastly, a graduate entry medical degree. So it requires you to have done a 3 year degree at least before, so Bachelor of Science or Bachelor of Arts, and then you can come back and do a graduate entry medicine. You can either do a graduate degree, which is accelerated, so for 4 years, or you can just come back and do the undergraduate 5 year degree, even though you have a degree on the back of that. So if you know that you want to be a doctor, please don't let sort of competition ratios or looking at your application stop you. There's so many different avenues for you to go down. Yeah, and I'll go into sort of specialty training just a little bit. So there's different pathways that you can take. So if you realize, okay, I want to be a medical doctor, so someone who's primarily works in a hospital, dealing with acute cases that come through, making up management plans for those cases. So if someone's got a pneumonia, prescribing an antibiotic, or if someone's got sort of fluid around their lung, putting in a chest drain, then you go down the core medical training pathway. So you do sort of 8 years usually after your foundation program, And then you can specialize in a medical pathway. So if you want to be sort of a dermatologist, if you want to work in A&E, if you want to work in cardiology, so to do with the heart, or respiratory, to do with the lungs. So yeah, there's also core surgical training. So you can, if you decide, okay, I want to be a surgeon, usually people do want to be a surgeon when they apply to medical school, even though that changes. Then you do similarly 8 years, and then you go on to be a surgeon. And in those 8 years after your foundation program, you'll be performing surgeries and getting better at that the more that you progress. And then there's also run through. So if you wanted to be a GP or obstetrics and gynecology, which is to do with pregnancies and women's health, then you could just do that straight. So you don't have to sort of do a core pathway. You can just, the moment you finish your foundation program after you graduate, you can just go on to train for that. And then lastly, acute care common STEM. So that's if you want to do sort of emergency medicine, acute internal medicine, more acute specialties. So things that happen really quickly, with loads of ambulances and sort of stuff like that. You can do an ACCS to help you know how to manage different diseases really acutely. So yeah. So how do you guys fit into this? You might be thinking, okay, this is so long ahead, what do I do now? So you guys are obviously at that pre-medical school stage. So now it's sort of looking at what you have in front of you, and planning ahead. So what do you need to do from this point onwards to enrich your medical school application? And also, what do you have that you might need to change, or what might change your direction? So I'll elaborate this on this a little bit further. So with medical school applications, it's a little bit different. It's mainly applying strategically. So they're really competitive. Everyone that applies pretty much has amazing grades and has done extracurriculars, super curriculars, like done work experience. So it's really competitive when you sort of apply, which is why when you do apply, you need to make sure you apply strategically. So apply to your own strengths. So if you're looking at your application, you have about 3 to 4 A stars, and you know that you're really academically inclined, then it would probably be better to choose a medical school that appreciates that. So, for example, Cambridge, Oxford, Exeter, those are all medical schools that, and you can see this on their websites as well, who sort of give you extra points for having higher grades or high GCSEs as well. So if you're someone who knows, okay, that's something that that's a really strong point in my application, make sure you factor that into what you pick. If you want to integrate, as I kind of mentioned before, so if you know sort of you do want to do an extra degree and you have sort of an idea of what you want to do it in, or even if you just know you probably need a year out before you go in and you want to use that to do an extra degree, make sure you apply for a medical school that integrates. Most medical schools, even if they don't integrate it into a medical school degree, will give you the opportunity to integrate as well. But it is kind of easier when you have it included. So all London unis, for example, they'll give you the opportunity to integrate. Location as well. So if you want to sort of stay in London, apply to London medical schools, if you want to stay up north, I would say the really good thing about medical school degrees is that it doesn't really matter wherever you do it. So I know with other degrees, it's really important if you do it in a Russell Group university and stuff like that. And obviously, if that's something that's important to you, definitely consider it, but don't let that limit you, just because remember you have to apply to your strengths. So you have to make sure that the medical schools that you are putting down on paper, because you only have 4 options, you don't have five, like everyone else does, that those you know, they're sort of in sync with what's really good on your application. And also the course type. So there's 3 course types. So that's the way the course is taught. There's PBL, so problem-based learning. So if you're someone who's more practical, you sort of like to get to the root of the issue and use your problem-solving skills, then PBL is great. I go to a PBL university, so I go to the University of Manchester. We do things PBL. So what that basically means is that every week you sort of have a case, a theoretical case, as if you were the doctor, and you have to come up with a list of questions to figure out what's going on, basically. So you go away, figure out what's going on, learn the pathology. So you always have lectures with anatomy and pathology that go hand in hand with the case. And you come back again, and as a group, you sort of discuss what you found, basically. So if you're someone who you kind of like that idea, great. If you're more sort of the person who likes to have a lecture, learn from the lecture, do your notes and do the exam, then probably an integrated course is better for you. So in an integrated course, you're just sort of having lectures. There's always going to be an element of PBL to medical school, just because as a doctor, you have to work in a team. but an integrated course, make sure that you have mainly lectures. So your whole week will probably be full of like 9 to 5 lectures, maybe a PBL discussion for anatomy. Yeah. And traditionals, that's only Oxbridge at the moment. They sort of just, they don't really prioritize the clinical aspect. So it's lecture based. There's not really that much PBL. That's the way they teach it. So if that's more for you, so if you're someone who knows when you qualify as a doctor, you don't really want to work with patients, which is fair enough. You're someone who's less clinical, more academic, maybe sort of a degree that is more traditional, like the one they offer at Oxford or Cambridge would be for you. So yeah, so make sure you be really strategic with your application. I'm going to go on to UCAT later on, but that is a big part of your strategy. And luckily you get that before you submit your UCAT. So your UCAT is due in October. Usually do your UCAT in the summer before that, so the summer of year 12, so pretty much now for you guys. And when you get that score, it will decide what you can apply to and what you can't. Don't make the mistake that some people have made, that they think that, okay, when you get a UCAT score and it's not that good, you can still apply for a medical school that doesn't really care about UCAT. Please don't make that mistake. They are really, they want to get rid of as much applications as they can. So if you come in and you don't meet their UCAT cutoff, your application won't even get looked at. So make sure you look at, okay, what are the UCAT cutoffs? The student room is really good because it changes every year. So the student room is saying, okay, last year the cutoff was about 2,800 and you got 2,800, perfect, you can apply. But if it's less, then maybe look at other universities to apply for, because you only have 4 options. I'm stressing. It's really important that you apply for medical schools that will give you an offer. You don't want to waste any of those. Okay, so going on to personal statement. So your motivation to study medicine is the biggest thing that's assessed. Medicine is really difficult, especially when you're a doctor. If you think about it, it's not always sort of helping people and saving lives. There are occasions where you can do the opposite of that, and it can be really, really emotional and really tough to take home. They want to see that you have, and similarly as well when you're studying, because the course can be quite difficult, there's a lot of content to cover. They want to see that you have some sort of motivation basically to keep you going when things get tough. The way it was explained to me when I was when I was in sort of year 12 and year 13 was that they don't want to give the place to a student who then can't really cope, and then they drop out, and then that space could have been given to someone who could have. So that's the way I used to think about it. So you want to make sure that your motivation to study medicine is very clear throughout the personal statement. So mine was, I spoke about my country, the Gambia. I spoke about how I've seen firsthand how having poor access to healthcare can be very detrimental to life. And so I want to be a part of making things better, something along those lines. But make sure that was immediately okay. Motivation to study medicine ticked off. So make sure you have that in your personal statement. Whatever motivates you, it can be something personal to you, it can be something less personal, like you're interested in science and this is a degree you've always wanted to do, that's fine. But just make sure it's seen. And again, you also need to demonstrate the skills required to be a doctor. So the Medical Schools Council, they have like a document for people who are applying to medicine. And it pretty much lays out what they want to see in your personal statement and the skills that they want to see. So they're basically assessing if you could be a good doctor, because once you graduate, you immediately become a doctor. So it's pretty much like, think about it like an early job interview, but you don't really know at the time. So yeah, so they're trying to see, okay, will you cope as a doctor? Do you have the skills required to be a doctor? Those skills are basically things like empathy. So you're going to be working with patients all the time. Patients are going to be ill. They're going to sort of need you to be emotionally receptive and be able to offer support when needed. Sometimes you have to break really bad news as well. So they want to be able to see that you can do that really well. Um, Showing empathy can be seen in loads of different ways. I think the way I did it was that I volunteered in a nursery. So I just put that in my personal statement and said I had to be empathetic to be able to do that. So that was sort of a tick already. Teamwork, it doesn't have to be in a science way. If you play in sort of a sports team, or if you've taken part in a sort of challenge and that needed a group of people, that's fine. You can put that on there. And that just shows you can work in a team. Again, working in a team is so important to be a doctor. It's never just you making a decision. It's always a group of doctors, a group of healthcare professionals who then come to a decision on how to treat a patient. Scientific and problem solving ability. So this is really important. It kind of sort of relates to the last talk. So MOOCs are a great way to show this. So I think I did a MOOC in medical neuroscience when I was in year 12. So that just shows that you're going above and beyond to show that you basically love science and you love problem solving and also you're good at it. There's other ways that you can show this as well if you don't have time to dedicate to a MOOC, but a MOOC is a very easy way to say you've done this and you have that ability. If you've ever worked in any sort of leadership team as well, or have been a leader, so I was head girl at school, that was something I put there. And also a desire for lifelong learning. So as a doctor, you're always learning, you know, science always changes. That's something that they want to see that you're able to do and something that you have a passion for. Showing off your achievements. So it is really odd in a personal statement, but you're basically bragging about why you're the best candidate. So you have to get used to that. But when they want you to show off, they don't just want you to list, okay, I've done this, I've done this, I've done this. And they want you to reflect on what you've done and how that relates to being a doctor and how that's made you more aware of medicine and how that's made you more aware of health. So it can be one thing to have a personal statement that's full of so many things that you've done, which is great. But at the end of the day, that's not a candidate that they want to see. They want to see that you can reflect. So, for example, okay, I did my work experience in St. Mary's. I saw a prisoner, which is true. I did see a prisoner that was my first time ever seeing a prisoner in handcuffs in my work experience. So I put that in my personal statement and I linked it to medical ethics. I said, okay, this just explained to me the importance of justice and um, everyone having a right and access to healthcare. So you don't want to just put, okay, I had my work experience in St. Mary's and I read this book and I went to this place and I was also head girl. You need to reflect on everything. And this also links to medical school. So actually throughout life as a doctor, you constantly always have a portfolio that you have to reflect on every year of medical school, every year that you're a doctor, even when you're a senior doctor. So they want to see that you can do this. Work experience is really important. Now, luckily, I was the COVID year, so you can do it online if you don't have any connects. If your mentor is able to link you up with work experience, that's perfect. Hospital work experience is the best. I would stress it if you do have the opportunity to, just because it's good, obviously, for your personal statement, because that's something that you need to have, but also it's good for you. It sort of solidifies whether or not you want to do medicine. So if you go there and you hate it, then obviously, you know, that's not really the career for you. But if you go there and you really love it, you love that the concept of working in the hospital and helping people, then it just solidifies that for you as well. And also, again, demonstrate that you have hobbies outside of medicine. So it can be really easy to just put everything about medicine and health. But they want to see that you have some sort of work-life balance. They want to see that you're a rounded student. So talk about other things. So I spoke about, I don't know, playing on the netball team and how I was president of Amnesty International. You want to show that you have hobbies that not that they don't just include medicine, that you're sort of a well-rounded person. Okay, so UCAT. This is the dreaded UCAT slide. So the UCAT is a main admissions test for medicine now. It's about a 2 hour exam. It is probably going to be, it is, no, it's not probably, it's definitely going to be the worst exam that you ever sit in your life, which is why you have to prepare for it. People aim for 6 weeks. That's what I would say. Too long, and then you miss your peak. So then you're just going to get burnt out, and then the exam won't really go as well as you planned. Too small, and you won't be prepared enough. Simply because it's an easy exam if there wasn't a time restriction, but the time restrictions are really, really strict. So that's what makes it hard. So it's pretty much something crazy like 30 seconds per question, and there'll be like a big chunk of text that you need to analyze and then answer the question. And if you don't stick to those times, then you run out of time. And then, yeah. So definitely practice. I would say start slow. So start familiarizing yourself with the questions and how to answer them without time conditions, just to get your brain in that space, because it's just you will never sit an exam like this exam. It asks you about shapes. It's just, yeah. So your brain sort of has to get used to it, and then once your brain gets used to it, then you can add the sort of time layer to it. The resources that I use and I would recommend is first the UCAT website. Please use that. Like everyone loves Medify. Perfect. Medify is really good. But the UCAT website is from the people who write the exam and they give it to you. Some people don't really use it as much as they should, but I would say that first. Then Medify. Medify is great. It has sort of timed questions. The questions are a little bit harder as well. So if you can do Medify, you can do well in the UCAT. And also this book on the right-hand side, I would definitely recommend. You don't obviously need to do 1,000 questions, just do a little bit a day, but it is really, really helpful for you to sort of get your head around, and it has answers in the back that are really detailed as well. So stagger out your revision. it is really hard. Some people pretty much sacrifice their whole summer, which is sad, but worth it. Do a little bit a day. So I booked my test and then I would just practice around the time of my test so that my brain just got used to it. So my test like 12, and I would do like 11 to 1 every day or something like that. So stagger out your revision, do a little bit every day. People that go crazy always burn out. Please don't do that. It is obviously a difficult exam and it's really scary because you can only do it once every cycle. But make sure you stagger out your revision and just take your time with it. Yeah, so I said people aim for 6 weeks. That's probably the best amount of time. And yeah, under time conditions and simulate the environment as well. So this is a top tip. So keyboard shortcuts will be your best friend. So make sure you learn the keyboard shortcuts as well. So I used to practice in my local library because I didn't have a PC at home. So learn the keyboard shortcuts and sort of do that on the keyboard. That's helpful. Interviews. So what do interviews look like? That was my biggest question. So you have sort of MMI, so multiple mini interviews. They're basically different rooms that you go into and there's a buzzer. It's actually similar to one of the exams that you sit in medical school, but yeah. So you go into different rooms and there'll be about two or one examiner or one examiner and an actor if it's a role play station. And they basically assess you and then you'll get like a final mark and then they'll tell you the outcome of your interview, obviously a few weeks or months later. You just have a panel interview as well. So that's if you, it's just you sat down like this, and then on the other side, there's like a bunch of people who are interviewing you. That's sort of being phased out now. So MMIs are usually the most common ones just because they eliminate bias. So obviously you're in a different station with different interviewers. So yeah, keep on top of recent health related news. This is the top tip that I would say. Yeah, so sometimes I'll ask you, okay, what's this? And it's something you've never heard of because it was on the news. Or similarly, they could ask you to explain to them something you've read in the news recently about health. So I used to just read like 10 minutes breakfast every day about on BBC News. They have a health section, or the Guardian has a health section, just to keep up to date, just in case they do. Know your medical ethics. So your 4 pillars of medical ethics, know that, because if you do an ethics and law station, which you probably will have, you pretty much that's just the answer to it. It will be about one of those medical ethics. You just have to link it back. Practice speaking with friends, family in the mirror, especially with role plays. Some of the role plays are really intense. Like the actors and actresses will literally start crying and stuff, and they just want to see how you deal with it. So you just have to get used to that. But also body language is really important. So making sure you're looking people in the eye, you're not fidgeting, you're really confident. And also practice means that if you do get a curveball, which most likely everyone sort of gets one on the day, you know how to react. So you just take a deep breath and be like, okay, that's a really good question. Thank you so much. And then apparently whilst you're saying that, you're supposed to be thinking. So that's a tip. But definitely practice. It can be quite difficult, but as long as you remain calm, you'll be fine. Usually the people who interview you are other doctors who are actually really lovely and friendly. No one's trying to catch you out. So just remain calm. So yeah, I'm just getting to the end now. I feel like I've definitely run over. So this is just a little bit about university life. So that's Manchester here in the side, the medical school that I go to. Medical school is more demanding than other courses, so you won't have as much free time, but you still should have free time. Don't let that sort of stop you from enjoying university life, because work-life balance is ultimately the most important thing, and you'll learn this throughout life. So make sure you do create time for yourself. Medical school is a weird one just because you literally have to know everything about the human body, but you have to come to terms with the fact that you won't be able to do that. So once you get over that hurdle, things do get a little bit easier, but do prioritize school first more than anything. And also just know that your sort of timetable is different to everyone else's. So you do have more hours from day one, from first year. You'll be like 9 to 5 pretty much every working day. So it can be quite difficult, but just try to find balance. Keep up with sort of societies, parties, social gatherings. Obviously, not too much, but just try, because it's obviously really important for your mental health to not just always be in the library studying. You have to find some sort of balance. I would recommend creating a personal schedule. That's what I usually do. So get my university timetable, get whatever else I want to put in, and make sure that I'm doing the things that I like doing as well. Make the most of every opportunity, whether that's academic, mainly academic. Loads of usually universities have like a newsletter. They'll send out things that you can apply for. So essay competitions are important before you apply for medical school, and also whilst you're in research as well. Part-time jobs that could also help your career. So just keep on an eye on that. And also please be prepared for freshers flu. it's very real. Make sure you have Lemsip, Anadin, paracetamol, because I thought that it wouldn't catch me, but it definitely did. So just make sure you're prepared. So yeah, any questions? My LinkedIn is my name, so Ida Sadie. So feel free to ask me any if you don't get the chance to. And thank you so much for listening.
Wow, wow, wow. Thank you so much, Ida. You've left me feeling confident that I would be happy to talk to you about any medical problems now. Not that I have any at the moment, but thank you very much. That was a really comprehensive presentation. And the thing that struck me most actually was that you shared so much of your personal experiences and your personal guidance from year 12 onwards through to medical school. And I, maybe I'm biased, but I really like the way that you emphasize the support that your mentor is giving you. So thank you for doing that. Neha, can I hand over to you to see if there are any questions?
Yes, thank you, Ida. Zoha's got a question. Zoha?
Hi. Yeah, I just wanted to ask, Ida, what would you recommend? I'm not sure if you did this yourself, but I just had a webinar today about the Crest Award. Would you recommend applying to that?
Yes, I've never heard of the Crest Award, but I would say apply for everything and anything. So I did very random things. I did sort of a Team London thing with the Mayor of London. I would say even if it doesn't directly link to medicine, there's definitely a way that you can link it. And anything to enrich your application, anything that sort of shows that you're someone who takes opportunities, you're at the forefront of your cohort, absolutely. So as long as you can sort of fit it onto your own personal schedule, I would say definitely apply for it.
Okay, thank you. Because it was quite a big commitment of like 70 hours. So yeah, but I think I will do it.
Okay. Yeah.
And anyone else with any questions for Ida?
If there aren't any questions from the students, I'd like to ask, I know you mentioned the Medical Skills Council, and I think you said that they have like information about what skills and characteristics for in doctors. Is that right? Did I pick up that point
Yes.
properly?
Yes, yeah. So if you go on the Medical Schools Council, they will have a PDF on there, and it's basically what they'll talk about the skills that they want you to show on your personal statement, and they actually have a few things on there for interviews as well. So it can be really helpful because they're sort of the body that regulates medical schools. So they regulate our exams, and they also regulate admissions as well. So it can be quite helpful. Also, I didn't mention it, but if you are someone who has widening participation, so I'm not sure if you guys are familiar, but if you come from a lower socioeconomic background, that can also influence your grade. So you might have a lower sort of grade that you need to get in, or a lower UCAT threshold. So if you are someone who that kind of relates to you, make sure you look into your options and use that to apply. And that's for any degree as well. It doesn't only have to be medicine, it applies to all degrees as well.
With those contextual offers and widening participation, the universities will often look at the school that you're attending to determine the approach that they take and whether they'll consider you for a contextual offer. So universities have systems in place already, but it's worth exploring yourself as well. Great stuff. Well, thank you very much, Ida.